know your program mostly focuses on implant dentistry, right?
Yes,
I will
yes.
be going off a little bit today because we will be talking. It still includes like a full mouth
Your
rehabilitation.
program mostly for
It's not gonna involve implants today, but we'll go over treatment planning and then a case that we did in the school with some complications about full mouth rehabilitation. So, how do you do the questions and Q&A? Is it gonna be at the end, or do you want it to
yes.
be?
It could be at the end because there's a Q&A section that we just type in your questions as you go ahead. It
Okay.
is easy for you to put in the chats, but at the end of the day, we'll go pick up the questions from the Q&A section. Thank you.
Okay. Perfect.
Please
Perfect.
introduce
And
yourself and take it away, sir.
yeah, and how much time I have? Is it an hour
About
or
60
less?
minutes. Yes, yes.
60 minutes. Okay. Perfect. Perfect. Let me open this. Um, see if I can. Hmm. Do you see the presentation, Doctor?
I see it.
Okay,
Clear.
perfect. So hello everyone. My name is Hassan Al Youssef. I am a prosthodontist in Michigan. I'm a part-time faculty. I'm a clinical instructor at the University of Michigan, and I also have my private practice where where I focus only on prosthodontic treatments and prosthetic surgeries too. Um, a little bit background about myself. I did my first dental training in Iraq, graduated in 2014. And then I moved to Michigan and I did an internationally trained dental program here. It's a 2.5 year program to get my DDS and get the license, US license. After that, I started the prosthodontic program. It's a 3 year program in United States to get my specialty degree. And I did that also at the University of Michigan. And the case that I'm going to present today actually is one of the cases that I treated while I was doing my residency, and it involved um, the prosthodontic department and also the periodontic program at the University of Michigan. So today we will be talking about treatment of biologic width violation and over-contoured restoration. This was a case report. I presented it at the ACP and also as a presentation at the Kingery Study Club in Michigan. And if you guys have any question at the end, please type it or feel free to ask it at the end, okay? Today we'll go over a little bit about the patient health and dental history of this specific patient, how we did the periodontal evaluation and treatment planning. We will talk about the prosthodontic treatment planning, the periodontal surgery, because it involved the surgical part and also a prosthodontic treatment. And in this case, I will show the face of the patient. We have taken the consent from the patient. I don't like posting it on social media because of the HIPAA in United States, but we have the permission to use it for educational purposes. So you will see the eyes and the face of the patient, and that's part of the treatment planning that you would see soon. So here's my patient, Kathy. She's a 58 years old lady, a very nice lady. She was employee in Ford Company. A little bit about her medical history. She had hypothyroidism, hysterectomy done a few years ago. She was taking Synthroid for her hypothyroidism. And she's a non-smoker. She drinks alcohol occasionally. And she doesn't have any allergies to any medications or any type of food, per her report. Dental history, she has done a lot of periodontal treatment. She has some extraction done, root canal treatment. She has a bite splint that she currently uses. She was like kind of going through a lot of bleeding in the gum, and you will see why soon in the coming photos. She's a grinder. She doesn't take a lot of sugar. Her sugar intake is very low. And she reports that she brushes 3 times a day, and also she floss 2 times a day. Here's the panoramic picture of the patient when she first presented to our department. So whenever we have a patient, we have a series of records that we take. We have to take panoramic, we take bite wings, periapicals. There are like 22 periapicals and bite wings. We also take intraoral, extraoral photos and history of the patient. So I will go over all the steps with you guys. So here's the panoramic. As you can see, a lot of restoration done. PFM in the back, new kind of ceramic restorations going on in the front teeth. And here's also her panoramics, the FMX that we took. You kind of notice some discrepancy in the front restoration, and you will see that the cause or the results of those poorly adapted restorations soon. Some good restoration in the posterior teeth, both on the right and the left side. We couldn't see any periapical lesions at that time. And let's come to the chief complaint, which is the most important thing in our presentation today. When she presented, this is how she looked. Her gums looked, and she presented the chief complaint that her gums are bleeding a lot. And when I asked her what happened, she told me that she had some front crowns that were old that she didn't like that much, and her dentist proposed changing her front teeth, which is, a very common treatment that we can see nowadays. 10 upper, 10 lower. In her case, were not veneers, they were crowns. They were done more than a year ago. And after they changed the crowns that she already had, she kind of faced this kind of issue. You will see severe inflammation of the gum, bleeding on propping, actually bleeding even when she's brushing. You can see the lowers, the uppers, pretty bad, and you can see the posterior is not as bad as it looks in the front. So when we presented, she brought in her documentation from her previous dentist. He was trying to treat this problem. He did send her to a periodontist. They did multiple allergy tests to see if she is allergic to the crowns that they did. These are zirconia crowns. She was not allergic to any of them. They also changed 2 of the lower teeth to another material, which is lithium disilicate. Still, the response was the same in her case. So at one point, they gave up and they referred her to school, to us, to kind of look at her and see what we can do for her. And that was like a year after that. These are some of the tests that has been done at the University of Michigan for allergies, and all of them came back as negative. These are some papers also, some of her tests, pathology tests. All of them are just showing that it's a pathological or localized response to the crowns, basically. So she presented to me end of 2021, and then we talked with Perio, and we kind of had a consult with Perio too. That was January 2022 at the University of Michigan. So they did their consult over all the steps that they have to do, and they reported that the etiology or the cause of this problem is deep and excessive crown margins. So they were kind of invading the biological space of the soft and the hard tissue. And also there were deep residual pocket throughout the mouth. And that's, as we can see from the inflammation. So they're mostly pseudo pocket. They also do at our school, they do a lot of research using ultrasound. And they found that the crowns had deep margins and also bulky crowns. These were the main 2 things that they reported to be the cause of this problem. So their treatment plan, again, they referred back to us for proper treatment planning. And they also suggested crown lengthening for maxillary and mandibular anterior 10 teeth. So she came back to me June 2022. And we decided to do what we always do, a set of records so that we can do a proper treatment planning for this patient, because it's a full mouth rehabilitation. So what we do, we take intraoral and extraoral photos. We take digital intraoral scan. We also take alginate impressions as well. Phasebo and bioregistration was taken. And again, when she presented, we always record her chief complaints, which was swollen gum and short square teeth. She was also not happy about the shape of her teeth. So my treatment plan for her was to do a diagnostic wax up. We do both digital and analog, and in her case, we did digital. We also plan to fabricate a guide for the periodontist to properly do their crown lengthening. Then after that, we will remove the existing crowns, temporize, fixed partial denture, and then move to the final restoration. So we always give the patient the full treatment plan and how long that will take, and how much also it will cost, so that we are all on the same page. That's something that the patient really appreciate when they come to you and they need full mouth rehabilitation. It's very important to tell them step by step what you're doing, who you're working with, and the expected time frame for the treatment. So here is the set of the photos that I took that day. This is one of the requirements of the ACP board examination for the prosthodontic specialty in the United States. You have to take a full set of extraoral photos and then also intraoral photos. Again, as you can see, her inflammation kind of ends in the premolar area. In the molar area, it was not as bad as the front. So the first thing that I usually do with all my cases that ends up being a full mouth rehabilitation is, sorry, let me go back, is face and smile analysis. There are different ways that you guys can do this. There are DSD design digital way that you can do it. 3Shape has a ExoCAD, Medit, all of them has smile design that you can use. There are also like New York reference paper that you can use. My favorite one is the Global Diagnosis. It's a book that was released in 2016. And they go over 11 points, and we will go over that with this patient one by one to see how we do the smile design and the face analysis. So the first thing that we look at is the face height. Based on many research, ideally you want the face to have three parts, all of them are equal in length. And then when you go and look toward the lowest or the lower third part, we also divide that into two portions. One of them is 1/3 and the other is 2/3 of the face. So this is kind of ideal. And here is in this situation, we have kind of ideal situation. There's no problem with that. And then kind of we zoom in. The second part we look at is the lip length. Based on a few research, they found out the average 30-year-old lady, they have 20 to 22 millimeter. And then in males, it's usually 1 to 2 millimeter longer. Number 3, which is something that's very important that I see a lot of people like kind of don't do it or don't look at it carefully, is the lip mobility. This is very important too when you're doing dentures or you're doing a full mouth rehabilitation where the patient is not happy with the smile. It's very important to look at the lip mobility and how much the teeth is showing when the patient is at rest and also when the patient is smiling. And you would see that a lot of patients, if they are not happy about their smile, they kind of have they are shy to smile big. So you kind of have to talk to them or record their face while they're talking, and they will give you the real smile where they're not aware of themselves. But if the patient is happy and they're happy with their smile, then you would see that they will give you the full smile that you need. Again, this is when she's smiling. Average is 6 to 8 millimeter of lip mobility, you can see. Again, lip is the framework of your smile. So that's very, very important to understand how the lip moves. It's one of the Hollywood personality in United States, Sylvester Stallone. You see that when he smiles, he kind of tend to move his lips kind of in a different way. So he doesn't have a nice symmetric lip movement. So that should be recorded so that when you do your smile design, that does not affect how your teeth are set up. That's very important. This is another one. In this case, you see like canting, how she smiles more on the left side than the right side. Another patient. It's another case that we did a full mouth rehabilitation on. And then after that, we come to the midline of the face. That's also very, very important. Compare the dental and the facial midline. And based on many research, if you have teeth that are kind of not on the midline up to 3 millimeter, there was a research that they were looking at. I think there were general dentists, orthodontists, and regular people who doesn't have any dental experience. They will show them photos of different people, and each photo, it's all the same smile. They will just move the centrals 1, 2, 3, 4, and 5 millimeter to one side. And most of them notice the change only after 3 millimeter. So that's very, very important to also be recorded in your smile design. Again, based on Shagali, up to 2 millimeter deviation is acceptable clinically. Based on the other research, it was even 3 millimeters also acceptable. Again, we have one-off cases that I had. This is very important when you take your photos. You have the patient's eyes horizontal to the parallel to the floor. You will see that a lot of patients, especially ladies, when they take photos, they tend to tilt their face to one side. This is one of my patients that she was not kind of happy about her smile. And whenever I would try to take a photo for her, she would kind of tilt her face to one side or move it just to hide how her smile is. But you would see that after we fixed her teeth, she was like very happy, and we should look at the lens, and we can take like proper portrait photos for her. So that's very important when you take your photos. All your photos should be ideal so that you can do a proper diagnosis on them. The fifth point is the central incisor exposed at rest. That's also a very important part. Usually young people will show 2 to 3 millimeter of their teeth at rest. That's considered normal. Older people, they tend not to show a lot of teeth, but for a lot of my patients, when they want a younger smile, we try to show a little bit of the teeth at rest. And my technique, to be honest, very simple. I tell them to say Emma and relax. You can either record them when they do that, and you can notice how much teeth they show, or try to take a photo. I would recommend recording because it's easier. Photos, sometimes it's hard to capture. You'd have to take multiple photos to kind of see that. And now we come to the important one, which is the gingival line to the upper lip in the full smile. As you can see, when she smiles now, she's kind of stressed. For young ladies, up to 2 millimeter gingival display is normal. It's not considered like a gummy smile. If it's more than that, then it could be considered a gummy smile, something to treat. In her case, you can see that the teeth are a little bit short, and you see like inflammation of the gum. there, it's very important to evaluate and do your diagnosis based on that. And the eighth point is the extent of your smile, or in other analysis, they call it the buccal corridor. A lot of papers recommend that if you have a dark corridor, it's not aesthetically pleasing. So they always try to have a full smile and to extend the distal extension of the smile. It's very important to evaluate that too, to determine how many teeth you need to do. A lot of cases you can stop at the premolar, but people who has larger smile, a lot of them would show even the molar. And that's very important because a lot of our cases here in the United States, they come and they want like gold crown for their molars. And one way that I evaluate it is to take photos and show them which one is the last tooth they're showing when they're going for a full smile, and then determine if it's appropriate to do a gold crown or not on the first molar. And usually you end up just doing it for the second one nowadays. And the buccal corridor also something aesthetically, a lot of people are not aware of it, but based on the research, if you have dark spot there, it's not aesthetically pleasing. To be honest, with my patients, a lot of them don't even notice that if you don't tell them. But it's very important for us as dentists to look at that too and be able to evaluate that and see if you can improve their smile. Incisal edge to the lower lip in full smile. This is also very important to evaluate to see the smile is canted or not. And then we go intraorally. In her case, you can see the length of the maxillary anterior teeth. You have to evaluate it. If you look at it, you see that number 9 in United States, we have a different numbering system, but basically the left centrals is kind of longer than the right one, and that's because of the inflammation. The actual crown is actually the same size, but kind of the inflammation that you get kind of change how the teeth look. So that's very important to know if the crown is actually short or is it the gum that's covering it. So in her situation, it's the gum. We kind of evaluated that too. And then the zenith of your teeth or tissue level. All these things, if you do it digitally, it takes you through that, and they have template where you put your smile in there, and they kind of basically take you through all these steps. But it's important to understand what each step means, and then why are you doing that. That's very, very important. Because nowadays everything is automatic. Again, the angle of the incisal plane, is it straight, it's canted, and that also needs to be evaluated. And this is very important when I show you the photo of Sylvester Stallion where he smiles, he kind of tend to move his lip on the left side more. So that should not like affect your planning, because you know that it's the lip, not the teeth, that kind of looks canted. And then we look also at the posterior occlusal plane. You kind of want to have a nice occlusal plane. If there is like a bump and lump in it, you would have to evaluate that and kind of talk to the patient. A lot of patients will come, they want only their upper teeth corrected, but because the posterior occlusal plane is not good, then you end up doing both arches. And in her case, it was not that bad. And then you look at if there is any pathologic tooth wear for her. Most of them were crown, so we didn't have any wear to deal with. And for this one, this is another very, very important point that we look at, is the location of the cement to enamel junction. It's very important because, especially for this case, You want to have the cemento enamel junction kind of 2 to 3 millimeter away from the bone. And this picture will come back to it. It's after the surgery. If you kind of invade that, if you make a crown that's too close to your bone, then you kind of invading that space and you would get the results that we are seeing right now, which is severe inflammation. And it will differ from one person to the other. And then finally, you look at the tooth color. This is mostly for my patients that comes in for when we do single centrals or two laterals, we look at the color, if it's something that we can match, or do we have to do all the teeth to get a better results? And again, in her case, we have all crowns, so we are not worried about that. And then, sorry, tooth alignment also. That's something, if you need to do, you can refer to ortho, or if you're doing Invisalign or clear aligner, if it's something that you can do it in office, you can do that by yourself too. So now what? After we have collected all this information, where are we going with this? We're gonna do a proper wax up for the patient, and that will determine our surgery, where we are going with this. And for this case, we did everything digitally, used Exocad plan or Exocad, sorry, to plan the wax up and create the surgical guide for the surgery. And in her case, it was easier to do digital, to be honest, because if you do it on a cast, which we do that too, you'd have to carve a lot of soft tissue, which is not easy. It's much easier to do it digitally. On the left side, you can see where we want to go with this. And then in the front, in the right, is the surgical guide that we created for perio to do the surgery. And then in July 2022, the surgery was performed, was done by periodontist, my friend, Dr. Mish. He did the surgery, and the surgical guide will tell him where the bone needs to be and where the soft tissue need to go. And based on that, they open their flap, and here you can see the bulky restoration that we have. And also, this is after they remove the bone to make sure that we have at least 3 millimeter from the bone to the margin. And we will be dropping our margin a millimeter more. So he gave me 3 millimeter from where the new margins will be to the bone level or the crest of the bone. So she came back in September for me to see her. I usually don't see the patient for 2 to 3 months after the healing completes. And then I see them. And this is when they came back. You kind of see a good improvement in the upper, and the lower was not done yet, but you kind of see a good improvement already in the upper teeth. Still a little bit inflammation in the two centrals, and we know that that's because we don't have a good space for those soft tissue to relax, so the crowns are too close to each other. So what we did, we removed all the crowns. This is how it looks under the crown. And we fabricate some temporaries for the patient. And we let her kind of go home with these temporaries. And then we do a follow-up after 1 month to scan the teeth for milled temporaries. This is when she came back. You can see because these are acrylic, it kind of absorbs coffee, tea, anything that the patient will drink. But you can see that the soft tissues now are very nice. Even the centrals, it's getting better. And canine area is even like, looks great at this point. And then we kind of scan our prep again to make some milled restorations. Again, you can see really nice and pink soft tissue around the teeth. Again, for a complete healing of the soft tissue, it takes up to 6 months. So we are still not at the complete stage. 3 weeks later, she came back. We delivered another set of temporaries for her. Those were milled temporaries that we delivered. This is how she looked. And then at the same time, we did the surgery for the lower teeth too. And you can see the color of the tissue now. It's very nice, all pink. And then the patient went. We were waiting for the soft tissue to heal in the lower two so that we can move forward. Then I think the patient left. She went out of town. 5 months later, she came back for final impression of upper teeth and removing the lower crowns. And when she came back, this is what we see. And I asked many of my friends what's going on here when we were doing the presentation. Now you see we have kind of going back to the same problem where there is inflammation, and the patient reported that she's taking care of her teeth. She's using water pick, flossing. But then what's causing this? This was something that was I was very annoyed by, because we fixed everything and now we're going back to 0.0. And then when we remove the temporaries, this is what I see, really angry tissue, back to 0. You can see the cause of the problem now was actually my temporaries. We have Dr. Beard. He's one of our kind of senior faculties. He always tells us when you do your temporaries, make sure you open the embrasures too much for the papilla to relax, for the papilla to have space to come down and form. And you can see from this area in the papilla region that my temporary is actually invading that space. And this is the result of that. So what I had to do basically, I removed the temporaries, and you see how much space we have. It's very limited. This came from the lab like this. So usually when I do my temporaries nowadays, whenever I get it back, I open it more than what they give me, because they give you based on how the tissue looks like at that point. But sometimes the tissues are not mature yet, so they need more time. So I do open it more so that they have more space. And this is what I did. We opened it a little bit more, and then I delivered it again. Cemented them, waited 1 month. Patient came back. It's going back to pink. So soft tissues you would see great transformation in within a month if you know how to manipulate with your restorations. You'll see a lot of complications that happen and a lot of things that you can easily fix that we are causing this problem. So you see that it went back to pink. Now we have this kind of dark triangle that we will fix with our final restorations, but we kind of have another back to nice pink tissues. It's not fully healed, but we're going back. Again, you remove the soft tissue. Now you see now the papilla is forming again, and it has its own space to grow again. And this is when you compare it to the day they came back after we delivered the milk. So you see how important our temporaries are when we are moving from the temporary to the final, and how we can make the tissue healthier by doing proper temporaries. Sorry guys, I'm trying to go faster. I know I'm going a little bit fast. This is again the back photo. We were talking about the invading the biologic width. You can do it with your final restoration. You can also happen with your temporary restoration. So this is when she came back. She was very with the temporaries. I was not happy with the temporaries, to be honest. The lab did them a little bit longer than what I think would look nicer. So again, before I move to the finals, what I do, I bring the patient again. We take a full set of photos. To be honest, the patient was happy because her gums are getting better, but aesthetically, I don't think those were like the good size of teeth for her. So what I usually do, I take the temporaries out, I adjust them, make them shorter, changed how the micro details of the restorations, and now they kind of look better. They're a little bit shorter than the original ones. They look nicer. And this is another set of photos during the same day. We kind of play with the temporaries. And this is where we are. This is where we started, and this is where we are with our temporaries. And now, once we know that we have treated the problem, then we kind of scan our temporaries and then move forward to make the finals. And then after that, she comes back. Again, you can see the soft tissues are healed in the upper and the lower. We take everything out, and then we make our final impression. And then we deliver our final crowns. So our final crowns. This is 1 month follow-up, and we saw the patient again. And I did the 1 year follow-up too. She's doing great so far. But this was just a month follow-up after the treatment. You see the tissues look pink now. She doesn't have any bleeding on brushing or when we were propping too. Everything looks normal. So this is where we started. This is where we are at right now. Thank you very much. So I think there are a few questions here. Doctor, do you want to jump in? Dr. Obo? Hello. I have few questions here. How do you test drive with analog method? Okay, so how do you test drive with analog method? So for her situation, we do know that we need to remove her crowns. Ideally, if we are talking about like a perfect person who comes to with a healthy gum, you just want to do full mouth rehabilitation. If it's only additive, you can do your wax up and then you can do a mock-up for the patient, and you can have them go home, try it for like a week, but not more than that. And then if they like it, you can move forward. With her, when we did the second set of temporary, which was the milled one, she kind of used it for like a couple months actually because she was going outside the country. And then when she came back, we did the change. She was actually, with this patient, she was happy. I was not happy with the length of the teeth, so we adjusted it. And then she used it for another couple of weeks. Then she came back, she was happy, I was happy. We took the scan and we sent it to the lab. Another question. Okay,
There's a
Doctor.
question there about your camera setting, your pictures. I think you're going to come back and give us a lecture on photography. I mean,
yeah, that will be yeah, that will be a whole different presentation actually. I don't teach photography, but it is a very important part of dentistry now, and Dr. Andriobe knows that in pros we have to have our own camera and take photos. Yes. So I would definitely recommend taking a good photography course. It will help. I took one when I graduated from my DDS degree, and it helped me a lot for my program to take nice photos.
What program was that? What course was that?
It was a private course in New York.
See. Okay. But
there are a lot of...
Yeah, I mean, Dr. Diveka, I guess you just want to find out what is your, in terms of your setup, what does your setup look like?
So I have a Nikon D750 with twin flash, and shutter speed. I usually do everything manual.
Okay.
Shutter speed around 200. Aperture usually for intraoral it's 32. And then I play with the only thing that I would change is the amount of light that comes out. You can decrease that if you want more texture or details in your teeth. So if I'm doing shade matching, I do like 1:8. So I reduce the amount of light. And if I'm doing a regular smile, I'll do 1/2. Again, it's very important to know your camera and then to kind of calibrate it to internal and portrait photo. So that's very important. For portrait photos, we have like a small studio that we use. So we have studio flashlights that we use that can take nice photos. And patient movement is very important when you take the photos. So let me move to the second one. I have time you took to remove all the crowns and special diamond points you used. So yeah, so these were zirconia crowns. And to be honest, the hardest one to cut is zirconia. A lot of companies that sell burrs, they have special burrs. They are diamond burrs for cutting zirconia. And there's the technique of cutting zirconia. I would say you don't kind of push or force it into the crown. You kind of have to touch the crown so that you're not burning your burr and you're actually cutting the zirconia. You cannot just put it on this crown and like press it down. You'll burn your burr. So it's very important how you actually touch the crown very lightly. I do that until you go through the crown and then you cut it. I usually do buccolingually, cut it into 2 pieces and remove it. If you have the right zirconia cutting pair, you probably can do that within like 15 to 20 minutes. Checklist for arranging for each appointment. Do I have a checklist? Well, we do only prosthodontics, so we have like setup for each treatment. We have a paper that we fill out for our assistants to set it up. I don't know for private practice it will be different. To be honest, I don't have any checklist. I'm sorry about that. Here it says I use calcium zinc chips concept by Dr. Mark Manhattan from Maha for gingival inflammation. Yep.
I think that's about all, sir.
Yep. Yep.
Thank you so much for giving us a part of
Yeah.
your weekend, Sunday. I know it's precious time, but this has been valuable
no
information, and we truly appreciate you, Dr. Hassan.
Yeah,
And
no
I'm
problem.
looking
I hope it
forward.
was helpful.
Yes,
If
yes.
they have any questions, you can shoot me an email. I'll be more than happy to answer.
Okay. Do you have are they able to reach, did you put your email there, or you want
No, I can put my email
Instagram?
and also, I can put it in the chat here if anybody has questions.
Okay.
I'm not big with Instagram. I don't open it regularly, but I do.
Okay.
Yep. Yep. I do have I do open it and it's private. You can send me a request and I'll confirm it, make sure I confirm it and we can talk. I will write my email too here. If you guys have any question, more than happy to. We can do that too.
All right.
Okay.
Thank you so much. Thank you so much.
No
Truly
problem.
appreciate it.
No problem.
Well, thank you guys from Ghana, from Ethiopia, from Kenya, from Nigeria, Rwanda, India, and I'm sure there's someone from Ethiopia and someone in the Middle East. This has been a very, very, it's a little bit different, but this is dentistry when we're covering the full sections. Thank you, Dr. Hassan. Looking forward to having you come to Dental Webinar Series very soon. All right, signing out here, guys. Thank you so much for joining. And for the folks in Nigeria, let's send this information out. And you can see the value of joining the Student Dental Implant Group. You get access to seasoned instructors from around the world. Looking forward to more webinars on the 8th of December. Let me pull that up. On the 8th of December, we're going to have Dr. Cynthia Uday is coming 6th on the 8th of December. She's going to be talking about splintered implant-assisted treatment options for full arch reconstruction. It's going to be powerful, knowledge-based, research-based, evidence-based. She's a fellow at the Mayo Clinic in the United States, and she's done a residency in prosthodontics, and she's constantly doing, a maxillofacial prosthodontic fellowship. It promises to be a great one. Well, anyway, I will see you guys next time. If you have any questions, send a message and tell your colleagues. Every clinical student in Africa should be a part of this group. Don't forget to share the YouTube channel to your friends, to your colleagues. Let's meet here. We're hoping that in the next couple of weeks we'll be able to, gather everyone that we know in our schools, in our communities. Thank you so much, and have a wonderful evening.